Hello guys, magandang gabi sa inyong lahat and welcome back dito sa channel natin. At ngayon ang pag-uusapan naman natin ay tungkol sa pagiging isang nurse again. Let's go back to our topic, no, dun sa mga series na mga topics na pinag-uusapan natin. At ang ngayon ang pag-uusapan natin is patient safety and confidentiality. Ikaw ay bagong nurse at papunta ka pa lang dito sa UK, bakit mahalaga na ihanda mo yung sarili mo dito? Hopefully makatulong tong video na to sa iyo. So we will be talking about confidentiality first, no? Kasi mahalaga to para ma-prepare mo yung sarili mo psychologically at saka maging reminder din ito sa iyo na pagdating mo dito sa UK, you can say, look, Anthony discussed this in one of his videos and I'm hoping that it will help you to remind yourself that dapat mong tandaan to. Kasi ito, ginagawa ko din para i-remind din ng sarili ko na ito yung mga dapat tinatandaan ko at iniintindi sa pag-duty ko, sa pagiging isang nurse ko. No? So, let's talk about confidentiality. No? Bakit importante at bakit mahalaga ang ganitong usapin, confidentiality. No? Sa UK kasi, just to give you a quick background, no? The culture of suing and the culture of compensation is getting a little bit out of control, no? So natumba sa kalsada, nadapa dahil medyo tatanga-tanga, sisisihin ay ang kalsada, hindi pinagawa. So dahil hindi pinagawa ng gobyerno, ang gobyerno ay dadalhin sa korte at sasabihin na it's the government's responsibility to fix the road, kaya siya nadapa, kaya siya na-injure, hihingi ng compensation, o hihingi ng damage, no? Hihingi ng, alam mo na, ng pera para makakuha ng pera. Ganon din dito sa hospital. Kahit saan sa UK, you have to make sure that everything that you do is more on spotless, more of, wala masyadong floods, no? Wala masyadong butas, no? So kaya umuso yung mga documentations, umuso yung napakaraming mga paperworks para i-back yung iyong mga ginagawa, no? Para patunayan na ikaw ay tama ang ginagawa at according to the policy and according to the rules and regulations, procedures ng lugar na pinagtatrabahuan mo. So that's the main, hindi ko naman sinasabi na that's the premise of what we do. Bakit mahalaga yung confidentiality? First and foremost is basically, ayaw mo kung ikaw ay isang pasyente na people knows about your business, no? Hindi ka rin siguro magiging masaya na yung kapitbahay alam kung ano yung nangyari sa iyo medically, no? Hindi mo din siguro magugustuhan kung yung doktor mo ipinagsasabi na ikaw ay nagkaroon ng problema sa health mo sa mga kapwa niya, mga doktor na hindi naman ikaw kilala, no? So you don't want that to happen. So in the UK, it's one of the most sensitive topic is confidentiality, no? So they put a legislation to protect people from any confidential issues, no? So yun, so pag-usapan natin, what are the things that you shouldn't do as a nurse with regards to confidentiality, no? Ano yung mga pwede mong at hindi mo pwedeng gawin kapag ka ikaw ay isang nurse na na nagtatrabaho sa ospital when it comes to confidentiality. First thing is, don't talk patient's information in public or with someone outside your work. No, so don't talk patient's information in public or with someone outside of work. No? Simple as. Huwag mong pag-usapan. Halimbawa, umuwi ka na. Wala ka na, nakauwi ka na, galing ka ng trabaho. Ngayon, yung experience mo, medyo gustong-gusto mong i-share, no? Gustong-gusto mong ibahagi. And sabi mo doon sa kaibigan mo, tanawagan mo, sige, ganito, ganyan, pasyente ko, ganyan, ganito. Ganito yung nangyari, ganito ang nangyari, blah, blah, blah. No? You are breaching the policy of your trust of your hospital. If you talk to someone else without permission, basically it's breach of confidentiality. So don't do that. Second is, don't post anything about work, about patients' information in social media. So whatever you do at work or whatever you do with your patient, don't post it on Facebook. Hindi ka pwedeng mag-rant na halimbawa, sinapak ka ng iyong pasyente, tapos ikaw ay galit na galit, fuming ka, pagod ka na nga, hirap na hirap ka sa trabaho, tapos wala pang consideration, sinapak ka pa, tapos galit na galit ka. And you can't use social media to shout out that you are frustrated, that something happened to you because of this person. And if this person is your patient, then you are breaching confidentiality as well. You can't talk, like say for example, someone who lives next door to you, next door neighbor, na hospital, ikaw ang nag-look after, kilala mo siya. Tapos ngayon dahil kilala mo siya, nag-post ka ngayon sa Facebook na so and so, it's nice to see you, hope you're doing really well, and blah blah blah, and discuss everything in Facebook or in YouTube or in Instagram. You can't do that. No, you can't do that. So you must keep information confidential and don't post them on Facebook or any social media in that case. Number 3 is make sure any handover sheets. No? Sa hospital kasi, pagka ikaw ay dumating, nagpalit ng shift, may handover sheets. No? Doon may susulat kung ano yung sinasabi, ini-handover sa iyo ng nurse na uuwi na. So, isusulat mo doon. May mga pangalan yun, date of birth, addresses, at kung ano pa, conditions. Make sure that the handover sheet or any papers that are no longer in use with patient's information should be put in the confidential bin and get shredded. No? So, dapat lang, wag mong iuwi. Minsan kasi yung iba nakalimutan. Nasa bulsa, tapos nakakalimutan. Pagdating sa dressing room, sa changing room, nandun sa bulsa nila, and you are not allowed to throw that in the bin. No, you can't throw that in the bin, or you can't leave that into your locker. No, you should bring them with you, go back to the ward, and put it in the place where it should be. No, and normally sa mga hospital, there's blue bin, a big blue bin. You can put it in there, and it's locked, it's covered, and then once a month or once na puno yan, someone will take it out and shred the whole confidential information there. No? So, you have to do it that way. Or, kung nakalimutan mo, umuwi ka na, wag mong basta-basta itatapon. Don't put them somewhere else, or don't neglect them, because they are basically confidential information that we should protect. No, sunod is, don't let patients' note be lying about, where members of the public can see and read on it. No. So, isa sa pinakamahalagang information na alam natin bilang isang nurse is we should always protect our patient. Protecting our patient is protecting their information. So, kapag ka nagsusulat ka ng notes, go to somewhere medyo private, no? Go to the doctor's room, go to the office, go to the bedside of your patient, go there, and so that a lot of people, not a lot of people would be able to see you. Not a lot of people would be interrupting you. No, para dire-diretso lang. So, wag mong panin. Ikalima na, always respect patient's wishes with regards to confidentiality. So, bakit ko sinasabi to na you have to respect your patient's wishes, no? Importante ito kasi may mga pamilya na ayaw nila na sila ay malalaman ng kanilang other members of the family na nasa ospital sila. O ayaw nila na pag nasa ospital sila, dinadalaw sila ng kung sino-sino. So, at may mga tao, may mga time na basta nilang magta-turn up. No? Sasabihin, may nakapagbalita siguro na si ganito ay nasa ospital. And then visitor will come. And then someone in the reception or you would allow them to go straight in. We should always respect patients' wishes. So what we could do is basically ask the name of the visitor, go to the patient, ask for the permission if she is allowing this person to come in. Especially those people who doesn't want to be seen. No, maraming mga tao may pinagdadaanan. So make sure that you comply to their wishes. Know the family that they want to see. No, alamin mo kung ano yung mga pamilya na members ng family na yun lang ang gusto nilang makita, gusto nilang kausapin, gusto nilang kasama dun sa kanilang bay, sa kanilang bed. No? Sa mga visiting time lang to. Tapos, know if they are happy and if their conditions is alright to share over the phone to certain family members. No, yan. Isa din ito sa mga malaking bagay. No? Kasi may mga tatawag sa telepono. So and so is calling, ganyan. I'm just wanting to know if so and so is okay, ganyan-ganito. I am her friend calling from next door, ganyan-ganyan. Hindi mo alam kung sino tong tao na to na tumatawag. No? Hindi mo alam kung ito ay concern o kung gustong magchismis o kung ano man. So, make sure that you ask permission first to the patient kung okay lang na ibigay yung information sa phone. But isa sa mga pinaka-importante na malaman bilang isang nurse is you give as little as ano to? You hindi makapag-English. You give the very little information over the phone. No? If you can say, oh yeah, she is fine. That's it. Don't add anything to that. No, unless otherwise, it's a very close family member and they are concerned and the patient is allowing that information to be discussed to your caller. No, don't explain anything, don't expand anything. If they are asking how she is, how he is, just say he is fine, he's had something to eat today. If you want to know more information and if the patient is happy, you can come and visit her on these visiting hours. That's all you can say. Don't give any more information because it's a breach of confidentiality. Okay? Next is, why do we have to do this? Ano ba? Bakit pa natin kailangan gawin to? Bakit kailangan itago ang mga ganitong information? Una, it's in breach of legislation on Healthcare Act 2010. So pagka ikaw ay nag-divulge ng information, you are breaking the law. You are breaking the law. No, bawal yan. Sunod is in breach of your hospital or your trust policy. No. Kapag nagsimula ka, you should be familiarizing your trust policies. No, you should be reading your policies with confidentiality, with hand mobile moving and handling, transferring patients, giving bloods, giving medications. Those disciplines, they have their own policies now. You have to be familiarizing them. I'm trying to familiarize every one of them. No? Kaya ang ginagawa ko, pag wala akong masyadong ginagawa, nagbabrowse ako dun sa trust namin, internet, sa SharePoint, Tapos nagbabasa ako ng pakaunti-konting mga policy para medyo alam ko din kung ano yung mga dapat ginagawa namin. So what's the consequences? Pagka ikaw ay habitually at saka intentionally breaking these laws and trust policies and procedures, it could lead to warnings, reprimands, and it could lead to dismissal. No? So, kapag ka una sigurong offense at hindi intentional, then you could be given a warning. No? But that warning goes into your file. That means you have on record. You are warned on record. Kapag ka ginawa mo ulit, you would be reprimanded. Maybe at a 1-week suspension or 2-week suspension for doing that. No. Pagka patuloy ka pa rin gumagawa ng kalokohan mo at di ka nakikinig, it could be dismissal. And the last thing is, it could be or it could lead to imprisonment. It could lead to NMC termination, your PIN license termination. So, ayaw mo mangyari yon. If this is your bread and butter, if you work hard to make your degree, to get your degree, if you study hard to get your degree, you don't want to lose your degree over some confidential information being shared on Facebook. Ayaw mo yung mangyari. So, make sure na hindi mo gagawin yan. So, my advice is always get any training. With this confidentiality information, policies, and meron itong certain training. Paano mag-keep ng information and what are the do's and don'ts. No? Get the training. Ngayong mga panahon na to, online na lang to. Madali nang kuhanin yung training. In about 30 minutes, the most, no? Ang training tapos na. So, madali ka lang maging matrain sa ganito. Always ask if unsure. So, kapag ka hindi mo alam na pwede ba itong i-discuss sa family? Pwede ba itong ganito na pag-usapan? Pwede ko bang sabihin sa pisyo na ganito? Pwede ko bang mag-advise na ganito sa outside resource party? Pwede ko bang gawin? So, pag hindi ka sure, ask your immediate supervisor, ask your sister, ask somebody who's senior to you. No, katulad ko, bago ako, 3 months pa lang ako. I could ask someone who's already been there for 5 years or 10 years. Or I could ask my immediate manager. No, sister, okay lang ba itong ganito? Kasi magpapadala ako ng referral na ganito sa ganito. Pwede ko bang i-discuss yung ganitong mga informations dito sa pagpapadalang ko na agency o pagpapadalang ko na ganito? Kung sa tingin mo ay hindi ka sigurado, medyo hand fire ka ng konti and ask for more informations. Number 3 is use your common sense, basically. Kapag ka alam mo na patient's information yan, wag mong i-post sa Facebook, no? O wag mong i-shout out sa Instagram o kung anumang social media. Make sure that you keep yourself safe at all times, no? So, those are the informations about patient's confidentiality. Pag pumunta ka dito, pag nandito ka na, at kahit nandito ka na sa United Kingdom, make sure that you protect your patient's safety and confidentiality. No, and this is one of them. Make sure that they are their information is kept properly and confidentially. Yun lang. Maraming salamat and God bless.